Nephrologist warns this everyday habit raises creatinine in seniors. Many seniors with stage 3 or above kidney disease watch their creatinine rise even when they follow every instruction. The hidden cause is often a routine they have trusted for years. Nephrologists caution that this habit reduces renal blood flow and forces the kidneys to filter under stress. In this video, you will discover what to stop doing and what to replace it with. The fourth point will surprise you the most, and a bonus tip at the end will give you an extra tool to support kidney health. We are starting with the one behavior that blocks kidney-supporting hormones and makes creatinine rise quickly in seniors with weakened filtration. Most people think this habit is harmless, but it changes kidney workload immediately. Now let's uncover the truth about excessive NSAID reliance. Excessive use of common pain relievers is one of the most overlooked reasons older adults with stage 3 to stage 5 kidney disease see their creatinine climb faster than expected. Many seniors rely on these medicines every week, and the kidneys react to them within hours of exposure. These drugs tighten the small blood vessels that bring blood into the kidneys, and this reduces the oxygen-rich flow that the filters depend on. When those vessels narrow, the kidneys cannot push enough blood through each microscopic filter. This slows the clearing of creatinine and causes it to build in the bloodstream. The kidneys respond poorly to this stress because damaged kidneys lose flexibility and cannot correct sudden shifts in pressure. These medicines also shut down the production of prostaglandins. These tiny hormone-like compounds help the kidneys maintain blood flow during stress or dehydration. When prostaglandins drop, the filters lose support. This reduces the glomerular filtration rate and forces creatinine to stay in circulation longer. This effect is even stronger in stage 3 to stage 5 kidney disease because the filtration rate is already reduced and the kidneys cannot compensate. Research teams at Cleveland Clinic have described how long-term use of these pain relievers increases the risk of sudden kidney injury in older adults. This means a small pill taken for joint stiffness can quietly push a senior into a dangerous rise in creatinine over time. A short burst of these medicines may be tolerated when a nephrologist approves it, but daily microdosing is a different story. Many older adults take tiny amounts during the day and believe that low doses are harmless. The kidneys receive a continuous stream of the drug, and the suppression of prostaglandins remains steady. The blood flow becomes more restricted each day, and the filtration rate slowly declines. This pattern harms seniors who already have weakened filtration strength. Many seniors also take these medicines without knowing they are consuming them. Combination cold medicines often contain hidden pain relievers. Joint pain blends carry small amounts that are easy to overlook. Sleep aids marked as PM products often include the same compounds. Arthritis packets for multi-day use may supply more than the kidneys can manage. When someone uses a pill organizer, it is easy to forget that one pill may contain more than one active ingredient. Stage 3 to stage 5. Kidney disease magnifies the consequences of this pattern. The kidneys cannot recover quickly from reductions in blood flow. Even mild dehydration, a salty meal, or a morning dose of a blood pressure drug can combine with a pain reliever and produce what many nephrologists call renal load stacking. This means several small stresses stack on each other at the same time. Seniors often take a pain reliever before gardening, then drink too little water, then take an afternoon blood pressure pill, and suddenly the kidneys face more strain than they can handle. Hidden sources also appear in items that seem harmless: joint creams with pain-relieving ingredients absorbed through the skin, and some portion enters the bloodstream. Sleep aids often combine antihistamines with pain relievers to increase drowsiness. Arthritis packets for weekend relief contain several days of dosing that many seniors complete without thinking. Small choices made throughout the day become a constant pressure point for the kidneys. Do you ever use a cream or night product without checking whether it contains a pain reliever? There are safer options for older adults who cannot tolerate more kidney stress. Acetaminophen can be used when a nephrologist confirms the safe limit. This medicine does not restrict kidney blood flow and is considered safer for many seniors when used correctly. Menthol or lidocaine patches support comfort without burdening the kidneys. Physical therapy-based routines offer gentle pain control with long-lasting improvements for mobility. Ginger-based teas made with low potassium recipes can ease mild inflammation without harming filtration. When choosing a product, label reading becomes essential. Look for names such as ibuprofen, naproxen, ketoprofen, or diclofenac. These are common in over-the-counter aisles and appear in multi-action blends. Avoid any product that uses phrases such as multi-symptom or arthritis relief because these names often hide multiple active ingredients. Check the ingredients every time, even if the packaging looks familiar. Changes in humidity also alter potency. Pills stored in warm rooms or bathrooms may degrade faster, and this creates unpredictable effects on dose strength. Older adults with stage 3 to stage 5 kidney disease must also be cautious about how these medicines interact with other prescriptions. Diuretics remove fluid and reduce blood volume, which increases the risk of restricted kidney blood flow when combined with pain relievers. Medicines that control blood pressure, such as angiotensin-converting enzyme inhibitors and angiotensin receptor blockers, increase the chance of kidney stress when the blood flow is reduced. Fluid retention is another concern because these medicines can cause the body to hold salt and water. Rising blood pressure leads to more stress on kidney filters and can accelerate creatinine buildup. Many seniors assume that small daily doses are safer, but this habit delivers constant pressure on filtration. Combining two different pain relievers without knowing it happens often during cold season, and this multiplies the strain. Topical products are often seen as harmless, yet many contain ingredients that still enter the bloodstream at low levels. A mistaken belief in safety leads to overuse, and the kidneys respond with rising creatinine. A simple lifestyle adjustment can help. Replace a morning pain reliever with a warm physiotherapy routine that loosens stiff joints. Add a hydration pattern designed for kidney protection by drinking steady amounts from morning to early afternoon. This reduces dehydration and supports stable blood flow. Small changes like these protect kidney filtration and reduce the chances of a creatinine spike for seniors with reduced kidney function. Now that this hidden habit is clear, let's move forward to a gentle food that supports filtration and reduces inflammation in a natural way. This next choice offers stability without stressing sensitive kidneys. The time has come to talk about the protective qualities of blueberries. Before we continue, tell me where you are watching from and how your stage 3 or above kidney disease has been affecting your creatinine levels. If you are trying to control rising creatinine naturally, make sure you subscribe to Kidnease and turn on your notifications. And if this helps you, type 1 in the comments or 0 if it does not. I want to learn what supports you best. Blueberries work well for seniors living with stage 3 or above kidney disease because they offer steady nutrition without placing heavy pressure on the kidneys. Each cup contains about 114 milligrams of potassium, which stays within a safe range when portions stay controlled. Low potassium helps protect weakened filters because the kidneys struggle to clear excess minerals when the filtration rate drops. Many fruits offer valuable nutrients, but several carry more potassium than the kidneys can handle, so blueberries stand out as a safer option. These berries also supply strong plant compounds called anthocyanins. These compounds support the lining of tiny blood vessels that feed each kidney filter. When endothelial cells stay healthy, the kidneys can move blood more smoothly through each filtration channel. Research from Tufts University has shown that anthocyanins lower oxidative stress in older adults, which is important because damaged kidneys face higher inflammation levels. A calmer internal environment helps slow the rise of creatinine by reducing strain on the remaining healthy filters. Each cup contains about 3.5 grams of fiber, which helps remove nitrogen-based waste through the digestive tract. This gives the kidneys a small break because less waste remains in circulation. Seniors with reduced filtration often deal with higher levels of toxins, so any food that shifts part of this load toward the intestines becomes helpful. Fiber also supports steadier blood sugar, which matters because unstable glucose harms kidney tissue over time. Blueberries contain about 14 milligrams of vitamin C per cup, which supports tiny blood vessels throughout the kidneys. This amount is gentle enough to avoid overwhelming the kidneys with excess vitamin C. High doses can raise the risk of oxalate buildup, but this smaller amount avoids that issue while still offering protective value. Portion size matters. Most seniors do well with 1/2 to 1 cup per day. Morning or early afternoon works best because sugar spikes late in the day can disturb hormone balance and increase nighttime stress on the kidneys. Pairing blueberries with low-phosphorus yogurt replacements is a simple way to add protein without creating excess phosphorus load. Healthy pairing helps maintain energy while keeping mineral levels under control. Buying the right type makes a difference. Frozen wild blueberries often contain higher anthocyanins because they grow in harsher conditions and produce stronger protective compounds. They hold flavor well through freezing, which keeps nutrients stable. Sweetened bags or syrup-based varieties should be avoided because they supply high sugar levels that raise blood pressure and stress the kidneys. Storing frozen bags flat keeps the berries from clumping and helps seniors portion them easily. Allow the berries to thaw slowly in the refrigerator to hold their vitamin content. Preparation can stay simple. A blueberry chia blend made with reduced potassium chia servings gives a creamy texture and adds digestive support. Chia seeds swell with water and help the digestive system move waste smoothly. A low-sugar compote made with renal-friendly oats gives warmth and fiber without creating a heavy mineral load. Gentle heating preserves much of the natural antioxidant content while keeping the dish easy on the kidneys. Too many blueberries at once can cause problems. Overeating raises sugar intake, which spikes blood pressure. High blood pressure places direct strain on kidney filters and accelerates the rise of creatinine. Seniors with reduced kidney function must balance nutrient intake with blood sugar control. Vitamin K in blueberries stays low, but people using warfarin should still watch consistency because any shift in vitamin K patterns can influence medication levels. Blueberries give steady support when used in correct portions and at the right time of day. They work as a safe fruit choice for older adults trying to protect kidney function while still enjoying flavor and nourishment. They help the kidneys manage inflammation, waste removal, and blood flow control without adding unwanted stress. If this is helping you understand your stage 3 or above kidney disease better, please like this video. A simple like tells YouTube that this topic matters and helps kidneys reach more people who are fighting creatinine issues every day. If you feel others deserve this knowledge, tap that thumbs up now. Next, the focus shifts to a warm and comforting ingredient that brings strong seasonal use and offers gentle help for circulation when used with care. This ingredient must be handled thoughtfully by seniors with stage 3 or above kidney disease because small mistakes can change how the kidneys respond. The spotlight now moves to the steady support of cinnamon. Cinnamon gains attention for seniors with stage 3 or above kidney disease because it influences several pathways that affect creatinine levels. One of the most important actions is its ability to support steadier blood sugar. High blood sugar produces glycation compounds that damage kidney tissue over time and raise creatinine. When blood sugar swings less, the kidneys face fewer harmful byproducts, so the overall burden drops. Many seniors notice their numbers improve when glucose control becomes more stable. This spice contains cinnamaldehyde and several polyphenols that support healthy blood vessel tone. These compounds help the small vessels in the kidneys stay more flexible. Better flexibility allows blood to move through the filters more smoothly. When filtration improves, the kidneys clear creatinine with less effort. Research from University of Michigan has highlighted cinnamon's potential to lower inflammation markers, and lower inflammation means less long-term stress inside fragile kidney tissue. Do you pay attention to how your blood sugar feels after meals and spices? A small dose is enough for safety and benefit. Most seniors do well with 1/4 to 1/2 teaspoon per day. This amount gives steady support without overwhelming the liver. Larger doses can strain the liver because certain natural compounds break down slowly in older adults. This becomes more concerning when the kidneys cannot clear waste effectively. That is why seniors need careful control over every ingredient they take each day. Choosing the correct form matters. Ceylon cinnamon contains much lower coumarin levels compared to cassia cinnamon. Coumarin can strain the liver, and this becomes a greater concern for seniors with reduced kidney function. Cassia is common in many grocery stores, so reading labels is important. Organic versions with a light aroma usually offer cleaner quality and fewer additives. Some varieties contain agents to prevent clumping, and these agents can irritate digestion in sensitive individuals. Storage in a tightly sealed jar away from heat helps preserve the delicate oils that carry most of the health benefits. There are several simple ways to use this spice safely. A small amount sprinkled over renal-friendly oatmeal adds flavor and warmth without adding minerals. It also pairs well with a blueberry smoothie because the antioxidant profiles support each other. A warm blend of cinnamon with ginger in water helps seniors start the day with stable blood flow and gentle digestive support. Ginger adds extra support for inflammation, which helps reduce kidney stress. Avoid mixing cinnamon with high-potassium fruits because this combination can overload weakened filters. Sugary drinks should also be avoided because sugar undermines the stabilizing effect cinnamon offers. There are risks when cinnamon is used incorrectly. Cassia cinnamon contains enough coumarin to irritate the liver when taken often. Seniors with slower metabolism may accumulate these compounds, which increases the chance of side effects. Another concern appears in people who use diabetes medicines. Cinnamon can lower blood sugar further, which increases the risk of low blood sugar episodes. Low blood sugar harms energy, balance, and kidney function in older adults. Monitoring how your body responds helps prevent unexpected reactions. Have you ever noticed dizziness or shakiness after taking certain spices or drinks? Cinnamon supports the kidneys indirectly by improving the conditions that control filtration quality. It does not repair kidney damage, but it strengthens the environment in which the kidneys work. Small daily habits can help or harm fragile filters. A carefully measured amount of high-quality Ceylon cinnamon may give comfort, flavor, and steady support without adding extra stress. The goal is balance and consistency, especially for seniors with stage 3 or above kidney disease. With this spice covered, it is time to focus on a cooling food that helps circulation and hydration without overwhelming the kidneys. This next option offers volume and freshness with very low stress on filtration. Now the attention moves to the gentle and renal calming qualities of celery. Celery offers steady support for seniors living with stage 3 or above kidney disease because it supplies hydration and minerals without overwhelming the kidneys. 1 cup of chopped celery contains about 260 milligrams of potassium, which stays within a safe range for moderate servings. This helps the kidneys avoid dangerous potassium buildup, especially when the filtration rate is reduced. The body depends on careful mineral balance to protect heart rhythm and muscle function. So low potassium foods give seniors safer daily choices. The high water content in celery helps maintain smooth hydration during the day. Hydration matters because steady daytime fluid intake reduces evening thirst, which protects seniors from drinking too much water late at night. Lower nighttime intake is important since weakened kidneys cannot clear fluids well while the body rests, and this lowers the chance of morning creatinine spikes. Have you noticed days when drinking late made your mornings feel heavier or more swollen? Celery also contains plant compounds such as apigenin and luteolin. These compounds have been studied by National Institutes of Health for their calming effect on inflammation. Chronic inflammation places pressure on kidney filters, so foods with gentle anti-inflammatory properties help lower this strain. Seniors with impaired filtration often carry higher levels of inflammatory markers, so even small dietary choices influence long-term kidney load. This mild support becomes useful when the kidneys struggle to manage ongoing stress. The natural sodium content in celery helps maintain a mild electrolyte balance without creating overload. This small amount offers flavor and hydration support, but the level stays low enough to avoid fluid retention in most seniors. Balanced sodium helps nerves and muscles work properly, which benefits seniors whose energy shifts with hydration levels. Most seniors do well with 1/2 to 1 cup per day. Early or mid-afternoon works best because eating then supports hydration patterns without creating nighttime fluid buildup. Juicing celery should be avoided because juicing increases potassium and sodium levels and removes fiber, which changes how the body handles these minerals. Whole celery keeps the natural balance of water, fiber, and minerals that the kidneys manage more easily. Choosing fresh stalks matters. Crisp and pale green celery tends to hold nutrients longer and avoids the decline in flavor and texture seen with aging produce. Browning or limp stalks signal nutrient loss, which reduces the health value. Storing celery wrapped in foil preserves moisture and crunch and slows the breakdown of natural compounds. Pre-cut packs often contain preservatives that may irritate digestion or change mineral levels, so fresh whole stalks are usually the safer choice. There are simple ways to prepare celery. A celery and cucumber slaw with olive oil makes a refreshing renal-friendly side dish. The combination offers hydration and healthy fats that support vascular function. Celery sticks paired with a small portion of low-sodium hummus add fiber and protein without placing stress on the kidneys. These light combinations help seniors manage hunger while respecting mineral limits. Large amounts of celery can cause digestive bloating in some seniors, especially when the digestive system becomes sensitive with age. Some people may also notice sodium sensitivity if they already retain fluid easily. Paying attention to how your body responds after eating celery helps you fine-tune your portions. We have looked closely at a vegetable that hydrates and supports circulation, yet kidney health also depends on daily habits that influence fluid movement during the night. One simple behavior shapes how creatinine appears the next morning, and many people with chronic kidney disease do not think about it at all. Now, the focus moves to evening fluid timing. Evening fluid timing matters greatly for seniors living with stage 3 or above chronic kidney disease because the kidneys slow their filtration rate at night. The kidneys work best during the day when hormones and blood flow support active filtration. During sleep, the body shifts its focus toward repair, and this reduces kidney efficiency. This lower efficiency causes urine to become more concentrated, which raises creatinine if too much fluid enters the system late in the evening. Many seniors do not realize that their morning blood work reflects what their kidneys handled overnight. Late evening drinking adds more fluid than weakened kidneys can process. This extra volume stays in circulation longer and increases pressure within the filters. When the kidneys cannot clear this volume fast enough, creatinine rises by the next morning. Clinical guidance from Johns Hopkins nephrology clinics stresses the importance of timing because filtration depends on steady rhythms that weaken with age. Hydration must be structured. Seniors should drink about 70 to 80% of their daily fluids before 5 in the afternoon. Early hydration supports blood flow and waste removal when the kidneys work at their strongest. Evening intake should be limited to small sips rather than full glasses. This prevents sudden fluid surges when the kidneys are slowing down. Warm ginger-infused water works well because ginger offers mild digestive support and does not raise potassium. Several mistakes can harm kidney function. Many seniors try to catch up on missed fluids by drinking large amounts late at night. This overloads the kidneys and disturbs sleep. Some herbal teas contain high potassium, which adds more filtration strain. Reading labels helps prevent these issues. A simple hydration window chart helps seniors track their intake without guessing. Pairing this habit with evening leg elevation reduces fluid pooling in the lower body and lowers nighttime kidney load. Let's pull everything together so you can act on it immediately. So here is a quick recap of the video. NSAID reliance increases creatinine in seniors with stage 3 or above kidney disease. Blueberries supply low potassium antioxidants that ease filtration strain. Cinnamon helps control blood sugar and inflammation when used carefully. Celery supports hydration and circulation with low mineral load. Evening fluid timing prevents overnight buildup and supports better morning creatinine levels. If this guide helped you manage stage 3 or above kidney disease more confidently, do not leave without subscribing to Kidnease. Subscribe because we only focus on kidney problems that truly matter for advanced stages. And if you feel understood and supported, type the word relief in the comments.